Rising cases of respiratory illnesses across the country. Ariel Reshef right here with the latest. Good morning, Ariel.
Good morning to you guys. Of course, these health experts are very concerned about the flu, COVID, the common cold, RSV. So far this season, we've seen already 5,000 deaths from the flu, 110,000 hospitalizations so far. Pediatric deaths, 5 of them reported in just the last week. That is making the total 16 so far. So this is concerning. So far, the CDC is reporting about 9.1 million infections from the flu so far this season, but experts warn those numbers could actually be much higher because the reporting is lagging here.
And it's putting a real strain on the hospitals.
Yeah, it certainly is. Right now, emergency room visits and hospitalizations are highest for the flu, and that's quickly followed by RSV and by COVID. What's most troubling here is that ER visits are most frequent from children right now, and that is because of the flu and RSV. COVID still accounts for the most deaths overall. Flu activity typically peaks between December and February, so doctors say it is still not too late to get vaccinated if you haven't already.
And on top of all this, norovirus is back.
Oh yes, if you have children, you know this one really well. That's we had these respiratory illnesses. Now we're talking about massive GI issues with norovirus. According to the CDC, there have been 130 more outbreaks of norovirus since August, compared to the same period last year. So that's concerning. Norovirus, of course, presents with nausea, vomiting, GI issues. Usually those symptoms resolve within 1 to 3 days, but you can be contagious and spread this virus for days after that. As we heard from Dr. Darian yesterday, Clorox those surfaces. Make sure you're washing your hands, not just with hand sanitizer. It doesn't kill the virus. You have to use soap and water.
1 to 3 days are brutal.
Yeah, I think people will say it takes you out.
Okay, Ariel, thanks very much.